Hello, everyone, and thanks for joining us today on our July chat of the month. I would like to say a massive thank you and welcome to the lovely Sadie Morgan. Hello. Sadie's going to be talking all about skincare, Botox, fillers, acne, you name it. I can't believe how many questions I got for this chat. It's like the most popular chat we've ever had, so I'm excited. But yeah, let's get cracking. And Sadie, if you'd just like to introduce yourself and tell us a little bit about what you do.
Of course. Hi everyone, I'm Sadie. I'm a nurse by trade, so I've been a nurse for 12 years, mainly worked in the emergency department at Torbay Hospital, and then about 4 years ago decided to take the plunge into the crazy world of cosmetics. Started out with just some basic Botox and filler treatments, and then just about a year in, sort of my passion for skincare sort of was overtaking the Botox and fillers. So started to train to be able to treat like the most common skin complaints. So just acne to begin with, and then going a little bit further into like pigmentation, and just general skin complaints, and learning about the different treatment options that there are. So yeah, I've got a little clinic now in Preston, in Paynton, and I work here full time, doing both now. So Botox, fillers, different sorts of cosmetic injectables, but a lot of skin. So yeah, probably 50% of my work is skin and the other half is Botox and fillers. But yeah, that's me really.
Love it. And how long has your clinic been open for, Sade?
So this will be the 4th year, obviously with a big chunk of lockdown in there as well. So yeah, this will be my 4th year running the clinic.
That's amazing. Can't believe it's been that long.
Oh, it's crazy, isn't it? Yeah. I still forget that I don't work at the hospital like properly anymore. But yeah, I'm always here.
I think it's amazing. My question is, to start, can you talk us through the whole process of becoming qualified in things like Botox and fillers? Because I am noticing on Instagram and all over the shop that everybody's doing it. And I'm pretty sure, like for me, I love the fact that you're a nurse, because I think that gives you like even more, qualification to inject my face, etc., or do whatever treatments I have. But yeah, could you give us a little bit of information about how you qualify?
So in every other country other than the UK, there are regulations regarding cosmetic injectables. The skin side of things is slightly different. So beauty therapists at level 4, so these are people that have literally done all of the college work it takes to become a beauty therapist. So sometimes I think that's 3 years. Sorry, there's a siren. So about 3 years of beauty therapy, and they do learn a lot of anatomy, and they learn a hell of a lot about the structures of the skin. So a level 4 beauty therapist can then go on to procedures for the skin that include breaking the skin. So microneedling, some medium depth chemical peeling. They're insured, and that is completely within their remit to offer those treatments. Somebody from zero beauty therapy background, so they're working in NatWest, can in this country book onto a course that weekend to qualify in microneedling and chemical peels. They can go away after their 2 days, and they can effectively treat patients in that remit. So again, in the UK, it's very much like do your research, make your own decisions where you go. I deal with a lot of clients who actually have now problems with their skin from going to people that don't understand the skin and having treatments that weren't right for them at all. And they can then that escalates into a whole new ball game, and we're then dealing with problems that they wouldn't have had in the first place. Botox and fillers, again, and injectables in this country, we don't have tight regulations. We have what is called basically advice, and that's how simple it is. If you go on Google and put who should do my Botox, Google will tell you that you should find a medical, professional, a nurse, a doctor, or a dentist, but it isn't illegal for them to do these treatments. They can't legally source their products. So my Botox, for example, I have a prescriber. Although I'm a nurse, I'm not a prescribing nurse because I haven't done a V300 qualification. I will do, but I haven't done it yet. So I have to have a doctor come to clinic, meet my clients. He gives me the green light for them to have botulinum, which is toxin, Botox. And then I get that prescription from him, black and white, and I order it from a pharmacy. If you go to a salon where they have someone in the back doing Botox, they're not a nurse, you will be able to walk in that day. You will be able to sit down. There won't be much of a medical consultation, and you will be able to obtain Botox that day. That is not legal. So in this country, we do require a face-to-face consultation prior to Botox. So they will offer you that Botox. I can't tell you where the Botox has come from. I don't know the background of the Botox, or whether it's traceable, whether it's legitimate. I don't know. It's a myth. I don't know how they get it. They get it extremely cheap, much, much cheaper than I can. Hence, the prices are a lot cheaper. So I guess it's just about making an informed decision, the same way that you guys have all made an informed decision to come to Leanne. And that's because she looks credible, and she's got a background, and she's got statements from others that tell you that she is good to come to. So I think really it's just about doing your own research and making a wise choice. Like, it is your face at the end of the day. Our faces are really complicated. It still puzzles me to this day, like the anatomy of the face, you know, there's still so much to learn, and I'm constantly going on these courses, and my mind's still boggled. And that's as a nurse, like, it still, you know, scares me. Some of the aspects are scary, and I don't offer every single treatment because some of them are too high risk. But you'll find that these people from the weekend courses with no background, they offer everything, and that will be, you know, they don't know the risks, they don't understand the risks, therefore, you know, they will do it. So I think, yeah, until the UK has regulations, that's the situation. So, and that's not to say come to me, go to anyone, but please go to like a medic, someone who has a certificate on the wall to say they're a nurse, a dentist, or a doctor.
Yeah, 100%, I agree. And for me personally, the medical background is something that's really important, especially when it comes to things like needles in faces and chemicals and stuff like that. I just personally would prefer somebody who knows what they're doing.
Well, we have quite like a popular thing that happens on social media where you'll see like a call for models, you see a call for models in chemical peels, you'll see a call for models for microneedling, and the price is like crazy low, and it pulls people in. Like, the amount of posts I see, and like honestly, there's hundreds of comments like, I'll be your model. Like, don't raise your arm to model for people. Like, a model means that person's literally done a small course, their needle maybe penetrated one person's skin. Like, do you want to be treated by them? Probably not. The answer is no. Go and pay more and be somebody's, you know, number 300 of that treatment than be somebody's first. Let someone else go and have the £60 treatment as a model. Wait until they're established, or go and find someone that is.
Yeah, I 100% agree. What would you say are the most high risk procedures that you see out and about that you don't like to do, Sadie?
So one of the most high risk is lip filler. I do a lot of it. I do enjoy lips. I've had moments in this career in cosmetics where I haven't enjoyed lips. And I think that's probably just managing people's expectations. People very fixated on Instagram and what a filled lip looks like, and me wanting to provide like a natural result for people. So they're high risk. Lips are full of veins and full of arteries, and they have to be taken with precaution. Everyone's lips are different, and it can go wrong. Even in like the best hands, lips can go wrong. In terms of filler, the areas that I don't treat are the nose. So rhinoplasty or filler to the nose, or these Tinkerbell lifts that you see advertised, or snatch and lift, or whatever they're called. Really high risk. We've got a huge artery that supplies blood to our entire face, and it's so easily obstructed by filler. So I don't offer nose filler. I'm not about to. I don't want to. I'll leave it to a doctor that's been doing it for 20 years, and let him deal with those implications for him. So don't touch the nose. And there's certain procedures that I just don't care to do because the risk is too high.
Yeah, totally understandable. So we have had so many questions from all the girls. So I'm going to fire a few out at you, Sadie, and see what you think. So okay. Emily asked, is there anything I can do or use to help my awful black eye circles?
Okay, so dark circles are really common. They're normally hereditary. So you'll find either mum or dad has got these indentations or dark circles. So this part of our face is called our tear trough. And it's basically anywhere that runs from here up in a triangular type shape, an upside down triangle there. So you do inherit them. They are a pain in the bum. They take a lot of concealer to hide. There are things that you can be doing at home to help. So there's some really good eye serums to use. So ditch the creams and go to the serum again. So eye serums that contain caffeine are really good for dark circles under the eye. And also so are anything cold. So women that suffer with puffiness under the eye or a dark circle, when you wake up in the morning, applying like a little cold compress to the eye really helps, gets the blood flow going. Ultimately, in terms of actually correcting a dark under eye, the treatment for that would be a tear trough filler, which as soon as you Google scares the living daylights out of you, because there's a 0.01% chance of blindness. There's an artery that if the filler goes into the artery, it could potentially run to the eye, which would cause blindness. It's very rare, and the way that we fill the tear trough is with a blunt cannula. So we make one little puncture there, we pop a little blunt cannula into the eye, and we basically just fan a very, very fine filler under the eye. So the eye looks lighter, the darkness is nearly gone after one treatment, and that lasts a long time. So 12 to 18 months, you'd be able to see a huge change, and then it would need redoing.
Do you offer that treatment, Sadie?
I do offer tear trough filler, yeah.
How much is that?
Tear trough filler is, how much is tear trough? 220. Sometimes it requires a second appointment, which is not another cost. So you come the first time, we let them settle, and then sometimes 4 weeks later we'll add a bit more. So barely any product is used. So very, very small amount of product, like 0.2 under each eye, if that. I get a lot of clients coming to me that have been for tear trough filler, and they've had huge amounts of filler inserted under the eye. The eye's now puffy, so it's not dark. The darkness is gone, but it's very swollen and puffy. And then that filler needs dissolving and correcting. So yeah, tear trough filler, again, find someone who's an expert on it. I don't claim to be an expert on tear trough. I've only been injecting tear troughs for about 12 months. And I pick my people very wisely. If I don't think you're a candidate for it, I won't touch your tear trough. So anyone with puffiness under the eye, it's a no. Tear trough filler is not for puffiness. It is only for an indentation or dark circle.
Oh, love it. And on that note, what about puffiness above the eye? Because when I wake up in the morning, I have I'm so puffy here. Is that like a thing?
So something really simple can help that. So it's not always easy because we all sleep in our own positions and we're comfy how we're comfy, but basically elevating your head even by like another 10 degrees will make a huge difference. So as we sleep, we have water in our bodies, and as we sleep, we get what's called edema. So edema just means like water from your body, because you're lying flat. During the day, our feet and our ankles can get a little bit puffy. That's because the water's obviously running down. When you sleep, you're horizontal, and all the water tends to sort of settle in our faces. So there are some bonuses to that. When you first wake up in the morning, you tend to look really good. If you've got lip filler, it looks really plump. If you've got cheek filler, it looks great. And you look a bit younger because there's a puffiness, a swelling to our face. And as we stand up, within the first hour of moving and our circulatory volume settles, that comes away from the face. So that puffiness with you'll find within the hour and a half of being up, it settles back down. So it is just water, and it's just water settling because you've rested for a long period of time in a certain position. Again, cold. So as soon as you wake up, not going for like a hot flannel or anything, but using cold water over the eye will help. It will just help it to basically constrict the blood vessels, and then the water will run away. But puffiness is a hard treatment. It's a hard complaint because there isn't a serum or a cream that's going to help with puffiness, but temperature does. So just keep things chilly.
Brilliant. Thank you. Kim asked, I have such dry skin, so other than drinking water, any other advice on that? I find sweat really affects my skin too. I'm really excited to hear about any products. I still haven't found anything that I love.
Okay, so dry skin's hard to treat. People with dry skin tend to go towards thick products that they think are going to hydrate them, and they will hydrate them for about 5 to 10 minutes. So the skin will basically think, oh, this is nice, yeah, I'll try and get some of this cream in. But the problem we've got is our skin's tight and it's closed. If our skin was open, we'd have an infection. Our skin is our barrier, so it's really hard to get past. So a thick cream is not going to treat your dry skin. So like an emollient that you'd get from the doctor, a really thick cream, it's not going to penetrate the skin. It's going to look good for 10 minutes and then it's gone again, and the problem is not solved. So the issue with dry skin is that barrier, getting through it and trying to treat it. So you need to go towards serums again. So people look at serums and think, it looks liquid-like, how is that going to help me? It's not thick enough. I promise you it will help. So a simple hyaluronic acid serum hydrates your skin. You can use that twice a day. You don't need to spend a fortune on it. You can if you want, but you don't need to. There's so many things on the market. So my hyaluronic acid serum is by Revolution. I think I get it on Cult Beauty. You can just Google it. Revolution hyaluronic acid serum. You don't want overcomplicated products. You just want what it says on the bottle. So hyaluronic acid serum, use that twice a day, straight onto the skin after cleansing. That's going to give you lovely hydration. And then if you want to splurge a little bit more, or you want something that's going to work a little bit quicker than hyaluronic acid serum, is a product like, so I have a brand in here called IS Clinical that I stock and I give to some of my clients, not all of them, but some of them. Leanne uses a regime by them. So IS Clinical do a product called Hydrocool. Now, Hydrocool is a serum. It's not a cream in any way, shape or form, and it is for dry skin. It's for skin that needs a massive drink. And no matter how much actual water you drink, it's not going to get to your face. So Hydrocool serum it will penetrate about 5 layers deep just from one application, and it will create moisture. You need moisture that stays under the skin and makes you look hydrated. So Hydrocool serum is really good. You can get Hydrocool serum online. You can buy it through me. I think that you can even do Amazon Prime on it these days. So yeah, Hydrocool serum, and stay away from thick moisturizers. Go towards serums for the dryness.
Perfect. Cassie has said, this is really exciting. I'm prone to breakouts around my chin area. I have a feeling it's hormonal. So how do I tackle this?
Okay, so you're probably right. It probably is hormonal. There are other things that it could be. So some of my clients will find that actually breakouts that have been going on for years in the same area are actually down to like a food intolerance. So sometimes it could be dairy, more than likely dairy. So if it is due to a food group or a product or something you're consuming, it's dairy is normally the one. It's not normally anything else. But if you cut dairy out, I know it's hard, but if you cut dairy out for a week and you saw an improvement, I could guarantee you that it's the dairy causing these breakouts. If it's hormones, that's fine. We can't remove our hormones. All of my spots in my life have always been from like my nasal nostrils sort of down here. And that's because they're hormonal. Mine weren't dairy. I tried that. It didn't make a difference. So if they're hormones, that's okay. You've got to have hormones, but we can tackle them. So anyone that comes to me with breakouts, whether we know the cause or not, we go back to basics. So this relates to so many people's questions as well about breakouts. Basically, back to basics just means like, are you actually cleaning your skin? If you are, how are you cleaning it? Because in the shower, in the bath, that doesn't count. That's your body, and that's having a wash with like perfumes and, you know, products full of stuff for our bodies. But our face needs to be cleaned with like facial cleansers, and it needs to be cleaned every morning and every night, like no matter what. That the same as brushing our teeth. That's how much of a part of your life it needs to be. And as you get older, this becomes like massively important for like aging, just getting rid of the day's grime and getting that pH on your skin where it needs to be in order not to create more spots. So are you cleaning it? If you already are, that's amazing. Look at what cleanser you're using. Is it a good cleanser? Again, you don't have to spend a lot on a cleanser. There's cleansers for £5-6. Some of the Body Shop cleansers are great, the foam cleansers. I personally double cleanse. So I double cleanse morning and I double cleanse night. I use a facial like bubbly type wash cleanser all over with lukewarm water, splash it off. And then I use a grainy cleanser. A grainy cleanser is really good for people that suffer with dry skin and spots and oiliness. It's just going to literally exfoliate that really, really basic top layer and just give your skin a little chance to recover from whatever the issue is. So my grainy cleanser is by a company called Wild Rising. She's a local girl. She lives in Paynton. She started her business a couple of years ago. It's all handmade. It's all organic. You're not going to have a breakout from it. And I use the product called Naked. And it's just literally run your hands under the water, sprinkle some grains, do this, create like a clay, and you basically rub, and your skin looks automatically shiny and healthy, ready for the day. So double cleansing, it's not expensive. You need water and 2 cleansers. And I promise you, both products will last 6 months. So it's not an expensive thing, but it makes all of the difference. Someone can come to me and they're spending hundreds on serums. They're like, I'm doing this, I've bought this, but they're not even washing their face properly. You've got no chance because you're going to bed and there's still grime from your day on your face. So all that's going to happen, by the time you wake up in the morning, you've got 2 new lumps or 2 new bumps, and they're your new spots. And then you're in a week's vicious cycle of getting rid of those 2 spots. And it's just like that. So clean your skin. I can't express it enough. Like, some of my clients come to me and I stop all their expensive products and just get them to double cleanse, and they have a couple of products to use, and that is it. So sometimes back to basics works. Don't keep changing your products. Literally have your products and use them for a good 6 to 8 weeks. Don't lose faith in them, because you might not see a massive change, but you need to just keep at it. It's about being consistent with your skin, the same as it's like being consistent at the gym. If you're not consistent, I promise you it won't work. And you'll blame the product. You'll blame the product. You'll say, I bought this, didn't work for me. No, it's rubbish. It's not. It's because you didn't do it morning and night every day, and you didn't you didn't play the game. If you play the game, I promise you, your skin will change. My skin was awful before I started knowing anything about it. I used baby wipes to remove my makeup. I didn't cleanse. I didn't know nothing. And I had spots. I was dull. My tone was all over the shop. So yeah, back to basics, basically.
So would you say definitely no sort of counter-based products like I used to use that blue Clearasil stuff that used to actually burn my skin for spots.
They're too strong. So you just need basic products. Look for places that, not claim, but look for people that it is organic. It is just what it says on the tin. IS Clinical, I use their cleanser. It's beautiful. It's just literally a pH balancing cleanser. You can put into Google pH balancing cleanser and you'll get loads of different options. You can spend £4, £5. All the Body Shop ones are great. Revolution do some great cleansers. So the grainy ones from Wild Rising, but double cleansing, not for everyone, but if you suffer with spots and all it means is doing 2 washes in the morning and 2 washes at night and your skin's going to change, it's worth doing it. People tell me they haven't got time to wash their face, but you're in the bathroom anyway. So if you're going for your wee, in your morning wee, then go to the basin, do your double cleanse, crack on with the rest of your morning. It takes seconds, but it makes a massive, massive difference. So double cleansing. The other main product I'd say for like consistently skin that's consistently breaking out like this, and Leanne, you've been there, I've been there. I had a point where I don't think I had a clear patch of skin in this area for like 3-4 months at a time. So glycolic. So that normally comes as a toner. So you always hear like cleanse, tone, moisturize. It's old school way to do your skin, but it does work. So toners tone your skin. So they get, again, that pH balance where it needs to be to tackle the day. So I only tone in the morning. So you can get glycolic toners anywhere. And I mean like from £4 up to £50. The Ordinary's glycolic toner is really good for oily, spot-prone skin. I use the NU Skin one. I think you do as well, don't you, Leanne? It's called exfoliating toner. I think it's called Here You Glow. Again, just Google it. But glycolic toners for oily, spot-prone, acne, even cystic acne. You can pop glycolic toner onto a cotton pad after you've cleansed and just literally work it around the area. It will sting a little bit, but it is working. Sometimes I always say it's like spicy. If it's a bit spicy, it's fine, it's doing something. If it's spicy, like you need to run around the house like a headless chicken, take it off. It's too strong, and it's not doing you any good. So with that acne, with those breakouts, and there was another lady that showed us like her lower chin area, back to basics, double cleansing, 2 types of cleanser. So a bubbler and something that's moving that skin on the top. Glycolic toner, absolutely amazing. And again, back to those hydration methods of hydration for skins that's covered in spots, because you're scared to put cream on. Go to the serums, go to hyaluronic acid serum. It's really hydrating. And you can put that right on top of spots, even if they're like full of pus, and you can work that product in and you will see a huge improvement.
Amazing. Let's talk about squeezing spots. Is there a traffic light system, or should you just not touch them at all?
So some spots need to be squeezed, and there's no two ways about it, is there? If a spot feels like it's under the skin and it's painful, but there is no head, you need to leave it alone, because there's no head. And like, you can tell yourself that if you squeeze harder, or if you get 2 bits of tissue and squeeze of there, eventually it's going to pop. It's not, because there isn't a head. A spot with a head is like a pustule spot where you can see the yellow, it's formed a head. That's fine to squeeze. Go and get 2 clean bits of cotton pad, and all you'll need to do is just press the skin. If it's ready to go, you'll press the skin and you'll remove that pus with the clean cotton pad and throw it in the bin. Don't then start squeezing so that you've got blood and water and fluid. You don't need to. You'll just get a huge scab, and that scab will cause a scar. So if it's literally fit to pop, press either side, it will probably pop. Leave it alone. If it's not, so my skin gets hard bumps underneath, no yellow head, no white head, no black head, nothing, just painful. Like, it can wake me up in the morning because I can feel it bulging. I have sat with towels, bits of paper. I've made the whole face white from squeezing. Nothing comes out of mine apart from water and blood. So all I've done is create a massive scab. It's going to be there for about 10 days. It's going to really annoy me. Can't cover it up because it's a massive scab, and then I'll get a scar. So no, just leave them alone. Unless they're fit to pop, please just leave it alone, because you push the bacteria around under the skin and normally create like spot number 2. So yeah, leave it.
I am definitely terrible at that.
You've all got in the house that, like, you think your skin's fine, and you get to that one mirror, you see like 10 blackheads, a big bump, and then you come back downstairs and you've wrecked your face.
No.
The blackheads are not coming out. Like, don't tell yourself that you're squeezing them out. You're not. You're opening the pores up even further. Just leave them alone.
Okay, Sam has written, can we please talk anti-wrinkle cream? It's not a particular concern at present, but could introducing one into a regime now deter them for longer in the future?
Absolutely. So literally anyone from 18 upwards can use a hyaluronic acid serum. Hyaluronic acid binds to water. It's a product that's like a real buzzword. You always hear like, oh, we use HA or hyaluronic acid. It is a buzzword because it works. Hyaluronic acid is what is inside that syringe of filler that I put in people's lips. It plumps things up. So it plumps your skin up. So a £6 hyaluronic acid serum by Revolution will plump your skin up. You need to use it morning and night forever. It's not like something you use for a week. You use it as part of your routine, and it's amazing for anti-aging. You can use it on your neck as well. And I always say to all my clients, like, please treat your necks, whether that's from acne or aging. If you don't, you'll be coming to someone like me in 10 years and saying, look at my face, I'm really happy, but oh my God, look at my neck. And your neck will have aged because you've left it alone and you've ignored it. So hyaluronic acid. The other thing that we could talk about for anti-aging is retinol. So another word that everyone is so confused by. Retinol is an exfoliating product that's always been in products, but the last 8 years or so now, people use the word retinol. Retinol is anti-aging. It's amazing at what it does, but it needs to be started with caution. Retinol can cause massive irritation, so you need to start low. Okay, so it's like anything. You wouldn't run in the gym and like grab the biggest set of like dumbbells and think that you could do it, because you can't, and you really hurt yourself. The same as retinol. If you just don't know what you're doing and you go on Google and you end up with like a 2% retinol, you think, I'm doing it, I'm using retinol, you're going to have such aggravated skin. If anything, it will look older than it did before you started using it, because aggravation causes aging. We need to just basically stimulate your skin. Retinol's only used at bedtime, never in the morning. Retinol makes us really sensitive to UV exposure. So if you're wearing retinol to bed, which everyone can wear retinol. You can put retinol on spotty skin, young skin, old skin, pigmented skin. It doesn't matter, but you will need to wear SPF in the morning every day, even in the winter, because your skin is really vulnerable. It will look great, but it will be vulnerable. So the retinol that I use is cheap. It's £8, I think, maybe £9. It's by The Ordinary. And you need to start on the lowest percentage of retinol available. So I think it's like 0.3% or 0.5%. If you use that retinol at bedtime and you're fine, and you get to the bottom of that bottle after 4 months, you can up your retinol. So the next time you buy it, buy the next one up. If you Google The Ordinary retinols, you can find the best information page. It's amazing. It explains retinol. It explains how to introduce it and how to increase your retinol percentage over the course of a couple of years. I get clients coming in and they like, just buy something, buy 2% retinol, and they're like, it's done nothing. It's obviously all just a fad. And I look at the bottle and I'm like, it's the strongest retinol on the market. And you've just started using it overnight, every night. They've got sunburn, they've got more pigmentation because of it. And it's just lack of understanding. So retinol, yeah, introduce it, but introduce it gradually, slowly. If your skin at any point starts to feel irritated, just do it every other night or do it 3 nights a week. Don't give up. Just know that a sensitive skin type needs a low dose of retinol. And we should all start low and work our way up. I could have upped mine probably 4 times since now, but I don't, because I'm really happy. My skin's behaving. I feel like my skin's looking okay age-wise. So I just stay on my low dose. Maybe when I get older, I'll increase it, but I don't need to at the moment.
And do you do that every night, Sadie?
Every night. So yeah, I double cleanse. Then I put my retinol on. At the moment, I'm double cleansing, putting a bit of Dove Summer Skin on to try not to look so pale, and then I put my retinol on. So you can put other products on. You can wear fake tan still. You can do all those things. But yeah, retinol is the last thing I do at night. Run my fingers under the tap, because retinol is an irritant. As much as it's great, it is irritating. So you need to wash it off your fingers. My husband, like, I buy stuff and he starts using it all, and then he's like, oh, I'm looking a bit, and I'm like, yeah, because you don't understand what you're doing. You're just going in there like serum, and he's like whacking it all on, and then he'd be like, got a couple of big spots come up, say it's your serums, and I'm like, well, no, it's because you don't know what you're doing, and you're just like basically robbing my product. So yeah, know what you're using, rub it off your hands, and then go to bed. Let the retinol do its thing. Retinol works overnight, but then in the morning you need to wake up and wash that retinol off. It's on your skin, so that there comes in your double cleanse. I have a Lumi Spa, which is like a cleansing device, and you'd be amazed. I double cleanse and then I go to bed in a clean bed all night. You'd be amazed sometimes what's on my Lumi Spa in the morning. It's not clean. Like, I don't know how, I don't know where it comes from, and it's not fake tan. It is dirty some mornings, and that's just oil that builds up as we sleep. And I used to jump out of bed, pick up 2 babies out of the beds, go downstairs, and never washed my face. But I moaned a lot about what my face looked like. So yeah, that's your retinol. So start low, and don't get cocky with it. Don't start ordering really high active products, because you're going to see bad changes, if anything.
Would you recommend a silk pillowcase, or is that just a load of BS?
I think it's good for like your crow's feet if you're a side sleeper. So if you're literally like me, I don't have one, but I sleep on my left side all night long, sometimes fall asleep on my back, but I always wake up in the same position, which is like this, like scrunched up to the side on the pillow. My eye always feels a bit swollen. I'm obviously, I'm comfy, but a silk pillow, I mean, maybe if you started using it in your 20s and you took pictures of each eye, I don't know, it could be a myth. It's very smooth on the skin. It's not irritating. Personally, I like a cold cotton pillowcase. Don't know if it makes a massive difference. Some of my clients do have silk pillowcases. And I guess it depends on how much those crow's feet are really bothering you. I can tell with all my clients which side they sleep on. Yeah, so when I do tox, as soon as I come to mark them up for their toxin, I always say, this is your sleeping side, isn't it? And they always say, oh, how do you know I sleep on that side? And obviously in the nicest way possible, I tell them that side looks a little bit older and a bit more
me eyebrow, because that's the side I sleep on.
Yeah, so all of that whole side will struggle more with wrinkles, like static lines, as you age. So you could try sleeping on the back, but it's really hard.
Yeah, and it kills me. I'm like an 8-year-old woman if I sleep on my back.
Yeah, not.
Okay, Sammy has said, now I'm in my 30s, I seem to get more spots than as a teenager. I also have very oily skin that is sensitive and gets dry easily, so struggle to find products to suit. Oh, there's a lot going on there.
Yeah. really combination skin going on, and none of your products will be like hitting the spot. So I'd go back to basics, start to double cleanse with 2 good cleansers, and you need a product like HydroCool that we were talking about. So HydroCool will get under the dry skin, and it will treat the issues with oiliness underneath the skin. It's a real staple product. It's not cheap. I think it's about £60. It goes a long way. So £60 probably for 6 months. We'll try and break it down. It's a tenner a month, but it will work. It deals with the most complex skin types. I've got clients in clinic that come in, they are dry, they've got rosacea, they've got oily patches and a bit of acne, and I always put them on HydroCool. 4 weeks later, I always get a text saying, like, I can't believe what this product's doing. So HydroCool, there's not always a best product for everyone, but HydroCool for a combination skin type that you just can't seem to get on top of, try HydroCool for 6 months, and it will really change the skin.
So do you just double cleanse and then whack your HydroCool on before bed? And
HydroCool is your moisturizer. Doesn't feel like it, and it's confusing because you're like, oh, it's a gel, it's not really what I want, but it will work. So morning, you double cleanse, you pop your HydroCool on, and then you should be putting an SPF on, an SPF moisturizer. If you don't like SPF moisturizers, you can get SPF serums. They're available online now. If you put in Best Facial SPFs, you'll get them up, get lightweight ones, but you need to be putting an SPF on. And then bedtime, again, I would literally just be doing a double cleanse and a HydroCool. That type of skin type can also really benefit from a low percentage retinol. So you could do double cleanse, HydroCool, and then a low percent retinol. Retinol is going to help turn over all those issues. So turn over the dry skin as you sleep, get rid of it. It won't be on your pillow, you can't see it, but your cell turnover on your face will speed up. So things don't last as long. So if you're using retinol, you've got a big patch of dry skin, that dry skin, instead of taking like 7 days to look a bit better, it will take 2 or 3. So it's not magic. It doesn't solve all your problems, but it keeps your skin turning over, which makes these problems disappear quicker. I still get bad spots. I sometimes get 2 huge hormonal boils, but my spots don't live as long on my face anymore. They don't scar me because I don't pick them. Because I'm using good products, I don't get scarring. Whereas if you're not doing anything and you've got these spots, they then turn into scars, and then we're dealing with like a whole different problem.
Yeah. So Liz has asked, I have large pores and have never really known what to do about that. She's also asked about anti-aging creams, which we've covered.
The large pores react amazingly to glycolic toner, which is what we were talking about earlier. So I use that Here You Glow one, the exfoliating toner. As long as it's got glycolic in it, it's going to work at closing these pores down. And the ladies will be talking about them here. So they tend to come across our cheeks, down our nose, and sometimes people struggle badly on the chin as well. Depends on the texture of our skin, but normally it's this zone with the pores. And remember, no one else can see your pores like you can. So these microscopic mirrors, I mean, they're great, but that's your view of your skin. Pores aren't normally detectable to anyone else, apart from maybe your partner, if they look that close. But glycolic will work really well. So glycolic toner, in terms of what I can do for large pores, lots. So regular microneedling, which is just a therapy that you come into clinic for. We oscillate little tiny needles all over the skin in like a vibrating method, and we go in different directions across the skin. That creates a healing response from underneath. The healing response takes a whole month, but as your skin heals from the little micro injuries that I cause, the skin closes over. So even after just one treatment, you notice a big reduction in pores, and things feeling tighter and more together. So yeah, microneedling is amazing for open pores. And it depends whether or not those pores are causing spots. Most people's don't. Most people's open pores just sit like little holes in the face. Sometimes the ones down here, people will say I've got lots of spots down here, but when you look closely, it's actually open pores. So we'll treat that with microneedling as well. It's hard to say until you sort of have someone's skin in front of you, but generally works really well.
Hannah's asked about dark circles, which we've done. Chantel has said about breakouts on her chin, which we've covered. She's also said about breakouts on her cheeks and her neck, which is, I'm glad she asked that, because my latest breakout has seemed to go down my neck, right on my throat. So that just goes back to what you were saying about making sure you're cleansing and using your products.
Yeah, just cleansing that area, remembering to clean it. And in the summer, like now in clinic, I haven't got a fan. I'm sweating so many parts of my body right now. Like, I'm not happy. And my neck feels all tacky. We put perfume there. You know, we rub different tanning products in this time of year, different sun creams, all of which need washing off twice a day, like thoroughly washing off. So just making sure that you treat upwards, not downwards. So anything you do with your neck, work your fingers this way. So up like that. Before every product you put into your neck, work it upwards. But yeah, higher cheeks, obviously sometimes this could have started in the low zone and then it's just spread because obviously the issue is bacterial and it's under the skin. Sometimes with bacterial acne or bacterial like cause spots, the GP will prescribe you like a steroid cream or something that's going to kill the bacteria, but it's going to cause immense dryness. Because it's basically like burning, it's a burning sensation as you apply it. It's going to dry it, it's going to go, but then you're going to have like more complaints of dryness. So chemical peels help with bacteria under the skin. Chemical peels help with a lot of things, but yeah, they really will kill the bacteria. So no dermaplaning this type of skin as well. Everyone needs to know that, like, don't ever have a dermaplane. If you have big spots on your face, don't let someone put a blade near it and aggravate it. So everyone comes to me after dermaplaning. Some of my ladies have got scarring from dermaplaning. Some have got pigmentation from dermaplaning. Some should just never have had it. Like, there's certain people that can have a dermaplane and there's certain people that can't. I don't even dermaplane my own face anymore. I'll do my lip because I don't like having white fuzz there. And I've got a mole that always has a hair in. Other than that, I don't shave my face, like, because ultimately that's what it is. It's like a shave. If you have spotty skin or large pores, all that's going to happen is you're going to get a ton of spots in a week and you're going to hate the person that's done that dermaplane for you. So just know that, like, not everything you see, not every craze is for your skin type. It's not, because that wouldn't work, would it? And dermaplaning has a lot to answer for if that blade's in the wrong hands.
And I think that's why when it comes to your face, it's the same with your diet, your routine, your exercise. It's really important that you communicate and have an appointment with somebody who can evaluate what's going on and give you the best treatment plan for you. Because like you say, I see it all the time. I'm going to get a dermaplane when I get my nails done, and you think, well, you're going in, you haven't had any type of consultation. Is that really what you should be having done?
Yeah, I know. And it's like what time of year you're having it done. If you're having a dermaplane in the summer, your skin's going to be really vulnerable for a few days. Then people are going out, sat in a beer garden, getting a sunburn. I promise you they're going to have pigmentation. They're not going to know what to do about that. It's just a vicious cycle. Like, you need to go to someone who understands your skin, offers you a skin consultation before they touch you. So no one comes here for a skin treatment unless I know their skin already, or they've been here for a 20-minute consultation and we spoke about what they're using at home, what's bothering them. I've looked at their skin and told them what's going on, and then we come up with a plan. So ideally, that's what everyone should do. And I'm not saying everyone's got the money to see someone professionally for their skin, but even if you just message me and said, these are my problems, I could tell you what to use at home. I'm not going to charge you to tell you what to use at home, or you can come for a consultation for £20 and have a chat about your skin. And get an idea of where to go from there. So yeah, not everyone
had a brainstorm idea, Sadie.
Go on.
What about us arranging, like, after like the COVID restrictions are eased a bit, like a ladies' night where we do like a skin consultation thing and see how many people want to do it, and maybe you could do it. We'll get like pay you and everything. It'd be amazing.
Down to clinic, yeah, definitely. I could talk about skin like all day and all night. So yeah, I love helping people with their skin. I was at a real rut place with my skin. I was really down. My main like search bar of Google was like full coverage foundation, best concealer. And I love when I get a client like I was, where their main priorities, like best cover up, best makeup, cover. And then all of a sudden they're at a place where like they're using a tinted moisturizer, no concealer. And you can just tell like the confidence in them is changed like overnight.
Amazing. So, yeah, we'll sort it out. Exciting. Just a couple more questions left. Charlotte Titterton wrote, mild acne here. It started after my second baby when I got the coil put in. Skin got progressively worse and was prescribed steroid cream, which did nothing. I've since had my coil removed, but I'm still waiting for the skin to clear up. Is this something that you commonly see when females change their contraception and hormone replacement?
Yeah, a lot. So obviously your coil, if it was Mirena, would have been estrogen only. So you would have had a surge in estrogen, which has given you the issues of your skin. Unfortunately, they're not just going to go away, those issues, because you've now got like a bacterial issue under the skin that needs to be resolved. So if you came to me, I'd probably put you on a really basic double cleanse and protect type regime in clinic. Some chemical peels might change that pH balance under the skin more long term. So I always say to people, if we can get you to a place where you don't get a spot for a month, I promise you the bacteria is then gone, because it doesn't live that long. So if we can get you clear with chemical peeling, so some of my clients will come every week for 3 weeks and have a course of this chemical peel, full depth peel. It's £165 for free. And by that point, bacteria is gone. So no more spots are erupting. And then you are problem solved, but you do have to continue to look after your skin in quite a rigid way at home.
Nice.
But massive changes in pregnancy, breastfeeding, contraception devices, pills, injections, it changes everything. I mean, men just get away scot-free, literally. Like my husband might get one spot every couple of months and he moans about it badly. Like, honestly, like the changes we go through is just, and we've got menopause to come. Like my clients going through the menopause, massive changes in the skin, massive loss of water in the face, real problems with dryness, crepey skin, products not getting past that barrier. And then unfortunately, and depressing as it is, we start to actually lose like bone structure at that point at the menopause, and our face tends to start sagging. So whereas none of this happens for men like in the way that it happens for us, it happens very slowly and in a much different manner. So yeah, we really are at a disadvantage.
Bastards. My husband literally, he in the shower, literally just soap and water. That is it. Oh, I think she's froze. This always happens. We were doing so well. Oh, she's back. She's back.
My husband, he loves it now. Got this hair. Yeah. Oh, hello. I was just saying, yeah, most men, it's just a shower job, isn't it?
Yeah, 100%. Okay. Amy's asked a really interesting question, which is, and I'm not sure if I'm going to pronounce this right. Can we discuss Masseter Muscle Botox?
Yeah.
I've been growing for years, which I'm stressed when I'm stressed and anxious. Since the first lockdown, my jaw now locks and clicks all the time.
Yeah, so it's really common. I treat lots of masseter muscles. So the masseter muscles here in the back of our jaw, I'm chewing gum, you can probably see mine sticking out. We all have a different size masseter muscle, and it gets bigger through practice, basically. So if you're a gum chewer and you chew like mad for 10 years, your masseter muscle is going to get bigger and bigger, and then eventually you'll end up with quite a boxy, square-looking jaw at the back. It's not very feminine look, and no one likes it. Women tend to not like that look. Obviously, clenching and grinding your teeth as you sleep is normally caused by stress, anxiety, or it can be a habit. So it can be just habitual. You could have been doing it for so long that your body does it as you sleep. You're not even aware. So sometimes clients will have been to the dentist and they would have been given guards. The guards are to protect the enamel really on the teeth so you don't break your teeth whilst grinding. They don't help with the tension it builds. They don't help with the headaches that it gives you, neck aches. It can give you all kinds of pain. So basically, yeah, I do that in clinic. We'll treat the masseter muscle back here, probably with like 6 little injections either side of the masseter. It's really effective. It's not cheap. It's £250. I normally like to speak to you a little bit deeper about like, what else have you done about it? Have you used guards? Have you tried different things? And we need to know that we're at a place where we need to relax that muscle, like it's really impinging on your life. And normally within 2 weeks, clients are no longer grinding. They come back for a review, and it's hard to review something that only happens as you sleep because they're like, oh, I don't know if I've been doing it or not. But then about a month later, they normally say, my face is so relaxed. I don't have a headache. I'm not tense in the morning when I wake up. My face feels relaxed. And that's kind of it for me. That means it's worked. and their partner, the people they sleep in bed with normally know, because obviously sleeping next to someone that's grinding or clicking, or even just moving that jaw around in sort of tension, that person will notice that they're not doing it anymore. So yeah, really effective treatment. It works every time. Does need repeating every 4 to 6 months.
There you go. Love it. Amy did also ask about her cystic acne on the chin, but I think we have covered that.
But yeah, cystic acne it's a worry starting new products when your skin's feeling that bad, and when your skin's getting you down like that, it's hard to like trust the process with products. And most people that have had a big problem with acne, we all know, we've all moaned about spots, but cystic acne is different. Really changes your confidence, really changes how you feel about yourself. You won't have a lot of faith in anything, and I totally get that. And that's why I always say to people, like, just come down, let me look at your skin, let me give you some ideas of where to start. I'm not about trying to sell like regimes for hundreds of pounds and think that they're going to keep returning. I'd rather someone have a regime that they love, it's affordable, and they can afford it all year, like whether it's Christmas or midsummer. You have to be able to afford the products you're buying. You need to be able to buy them again without it breaking the bank. And yeah, just stick in at a routine, but it will go. It won't. You don't have to have cystic acne forever. It's just knowing what to use.
And consistency being the key with your routine as well.
Yeah.
Is there anything in terms of diet and exercise that you would like recommend, or any tips to do with food? Obviously you've mentioned about dairy, and dairy was one of the things that I looked at when I was treating my skin, and I don't have cow's milk anymore. But like anything else, any other tips?
A lot of my clients will agree with me that like one heavy weekend of takeaways and alcohol, like unfortunately your skin is going to show it. Our skin is like a mirror of like our guts. So basically whatever's going on in your gut, and at the time when my skin was really bad, my diet was terrible. I had a 1-year-old and a newborn, I had no time for myself. My break in life was like, while they were napping, I'd go through the drive-thru and get a caramel frappe and a double cheeseburger. That was like the highlight of my day, my me time. I ate crisps and dip probably 5 nights a week. Chocolate. Yeah. So basically your skin is showing me what's going on in your digestive system. If you're not going to the toilet every day, there's a problem. Things are too slow. Things aren't going through properly. You're probably not eating enough fiber. Your skin will look congested. Your skin won't look well. People say like, oh, your skin's like glowing. It's not. If I have a heavy weekend, if I have a weekend of eating whatever the hell I like and drinking cocktails or lager, or, you know, I promise you my skin, the next, probably doesn't happen straight away, but the Tuesday, Wednesday, Thursday, that next week I'll have spots. My skin will be dry. It'll be really problematic. So absolutely, your skin, our skin's job is to protect our body. But if you don't look after your gut, like, it will show on your face. And that's, you know, where the dairy comes in. If you have an intolerance and your gut is aggravated, your skin's aggravated on your face. And it kind of just shows you, you know, straight away. Like, I drink water like never before. I'd never drank water when the kids were babies. You know, you just put yourself in a different, you're not priority when you've got small children. It's really hard, and I get it. But to feel confident, I promise you, like, couple of things, even if you just change your water intake and your cleansing, you'll see a huge change.
Amazing. So many amazing tips and some great advice. Thank you so much, Sadie, for volunteering your time for this. I really appreciate it. And we've got to do a shameless plug for Sadie, because Sadie's been sorting my skin out for ages. I shared my before and after picture in the group. I have regular microneedling, regular peels. She does my Botox. Don't tell my mum. Which is why this eyebrow now isn't quite so far up my head now, giving it the old. So please make sure you share her and follow her on social media, Sadie Morgan Aesthetics, and please message her for any tips. And if you are thinking of getting Botox, fillers, peels, needling, anything, she is definitely comes highly recommended by me.
Thank you, lovely. Thanks, everyone.
Thank you so much, guys, and we will speak to you very soon.
Bye.